Okay, now we're going to look at hyperthyroidism in children. So it's whenever you have too much of the thyroid hormone production, too much T3, T4. Causes of this could be Graves' disease, thyroid nodules, or goiter, which is the same thing. So signs and symptoms of hyperthyroid: weight loss, tachycardia, they'll be irritable, heat intolerance, they're always going to feel hot, sweating. So Graves' signs and symptoms, because remember it causes Graves' disease, is goiter and bulging eyes. The way that I remember that is goiter for Graves, and then when you're in a grave, think dead. When you're dead, maybe your eyes will bulge out. I don't know. Okay. To diagnose, they're going to have high T3 and high T4 levels, and their TSH is going to be low. So, what I have here is a thyroid storm. So a thyroid storm can happen, and it's an emergency. It's a life threat. So signs and symptoms of a thyroid storm is you're going to have high fever, a high heart rate, restlessness, sweating, and they'll have signs of shock. So treatment for hyperthyroid, you're going to want an anti-thyroid med. So methimazole. It'll have like a methimazole and then MTZ. So this stops the thyroid from making too much of the T3 and T4 hormone. And then you have radioactive iodine therapy. This is only for kids 10 years old and up. So you don't want to give it to younger ones. This will destroy the thyroid within 6 to 18 weeks. So that's why you want it to 10 and up, because it's not, you want to be really careful with it. So you take this by mouth. It is a long-term therapy, and it can lead to hypothyroidism. Since it's destroying the thyroid, it can essentially go south in the opposite direction. Or surgery, the subtotal thyroidectomy. So this is used when the other drug therapy can't. It has high risks. Like you could have hypothyroidism or hypoparathyroidism, and you could have laryngeal nerve damage. So nursing management. You want to educate the family about meds and their side effects. Like we talked about how radioactive iodine therapy can lead to hypothyroidism. And we talked about how the surgery could lead to laryngeal nerve damage or hypothyroidism as well. So adverse side effects could be a rash, leukopenia, loss of taste, sore throat, GI disturbances, arthralgia. If the med is taken 2 to 3 times a day, you want to encourage them to use a pill dispenser and alarm so they don't forget. And then you are going to have to do routine blood tests and follow-up visits. You want to make sure that they're actually doing those, because you want to be constantly checking these levels to know when to stop the medication. So how to cope with signs and symptoms. So like signs and symptoms like heat intolerance, emotions, eye problems. The child may need cool blankets. Or a healthy diet, 5 to 6 meals a day. And make sure that they don't do PE. They can't do PE at school. No like crazy exercise, because that'll make them sweat and it'll be really bad. And then here I have like a little difference between hypo and hyperthyroidism. So hypo, you're going to have weight gain. Hyper, you're going to have weight loss. Hypo, you're going to have slow heart rate. Hyper, you're going to have fast heart rate. Hypo, you're going to be tired and sluggish. Hyper, you're going to be hyper and anxious. Hypo, you're going to have cold intolerance. You're always going to be cold. And for hyper, you're going to have heat intolerance. You're always going to be hot. Hypo, you're going to have dry skin and hair loss. And for hyper, you're going to be sweating. Think of the opposite of dry. You're going to be very moist because you're sweating. And you're going to have goiter and bulging eyes for Graves. So hypo, low and slow. Hyper, fast. Everything's fast.